Okay, guys, tonight's discussion C highlights serious health issues women face when it comes to research for different diseases they encounter. So, we're going to discuss that for C tonight. So, please join me in tonight's discussion C women's health issues, serious illnesses they face. Okay. The article highlights a critical issue in medical research. Women face higher risks for serious health conditions like Alzheimer's, osteoporosis, and yet they remain underrepresented in key medical studies. The lack of significant research focused on women's health contributes to gaps in understanding and treatment options, potentially putting women at greater risk for these conditions. Additionally, the page includes related discussions on hormone replacement therapy, or HRT, for managing menopause symptoms, emphasizing the importance of informed, personalized healthcare decisions. The unrepresentation of women in medical research has serious consequences. Okay. Give me 1 second. Fertility and family planning. They raise awareness about infertility among women, physicians, and advocate for workplace flexibility and benefits coverage. Global Health, AMWA, collaborates with the United Nations Department of Global Communication and participates in the UN Commission on the status of women, medical humanities. They foster artistic and creative expression within medicine, featuring an artist and Renaissance program. Would you like to explore how you can get involved in one of these initiatives? Okay, hold on. Got more. Advocacy. AMWA actively pushes for gender equality in healthcare, influencing legislation and policies that impact women's health. They engage in voter registration efforts and civic engagement campaigns, career development programs like Elevate, Corn Ferry Leadership, Youth for Humanity, for physicians involved, for residents, and integrate for medical students, provide mentorship and leadership training, diversity, equity, and inclusion, or EI, DE, DEI, AMWA supports gender equality initiatives, anti-racism racism efforts, and health advocacy, and military veteran outreach. Okay. Hold on, guys. Physician advocacy. Many female physicians use their platforms to raise awareness and push for better healthcare policies, ensuring women's health issues receive the attention they deserve. These efforts are helping to close the research gap and ensure that women's health is prioritized in medical studies. Would you like to explore how you can get involved in advocacy? The American Medical Women's Association, or AMWA, is dedicated to advocating for women in medicine, advocating for equity, and ensuring experience in healthcare. Their work is structured around three main pillars: professional, personal development, advocacy, and education. Here are some of their key initiatives. Would you like to explore how advocacy and policy changes could help address this issue? There are several advocacy efforts aimed at addressing the gender gap in medical research for women. Okay. Health outcomes. American Medical Women's Association, or AMWA. This organization actively pushes for gender equality in healthcare, influencing legislation and policies that impact women's health. Society for Women's Health Research, or SWHR, advocates for increased federal funding and policy changes, including initiatives like Spirit for Women's Health, an initiative, and the Department of Defense's commitment to women health research. Male participants resulting in misdiagnosis and ineffective treatment for women. Autoimmune disorders, conditions like lupus and rheumatoid arthritis disproportionately affect women, yet research has not inadequately explored gender specific triggers and treatments. Depression, anxiety, women experience these conditions at higher rates, but studies often fail to account for hormonal influences and gender specific responses to medication. The consequences of this research gap are far-reaching, affecting diagnosis, accuracy, treatment, and effectiveness, and overall healthcare outcomes for women. Significantly impacted by the underrepresentation of women in medical research. Here are some most affected conditions. Alzheimer's disease. Women are at a higher risk of Alzheimer's, yet much of the research has historically focused on men, leading to gaps in understanding how the disease progresses differently in women. Then you've got osteoporosis, guys. Since women are more prone to osteoporosis due to hormonal changes, the lack of female focused studies showed advancements in prevention and treatment. Cardiovascular disease. Heart disease is the leading cause of death for women, but clinical trials have often prioritized women. Medical research doesn't account for these differences. Women are often prescribed medications or therapies that haven't been adequately tested on them, increasing the risk of adverse effects. There's also a broader impact when research overlooks women's health. Public awareness and healthcare funding tend to follow suit. This can mean fewer resources dedicated to preventing, diagnosing, and treating conditions that primarily affect women. This aspect of this issue interests you the most? Are you thinking about how to advocate for better research, looking for information on specific condition? Several diseases are. Give me a second, guys. Be right with you. That ripple across healthcare without adequate studies focused on women's health. Doctors and scientists struggle to fully understand diseases that disproportionately affect women, like osteoporosis and Alzheimer's. This leads to delays in adequate diagnosis, ineffective treatment, and even misinterpretations of symptoms. The major issue is that many clinical trials have historically focused on male participants, assuming that findings will apply universally, but biological differences between men and women, hormonal changes, metabolism, and genetic variations can significantly affect how illnesses progress and how treatment works. Okay, guys, so that is it for tonight. We'll see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.